Well, thank you very much, Sandra, for that lovely introduction. And good evening, everyone. Oh, good. We're not in the postprandial slump, so I'll get through my comments, and then everybody will start to fade a little bit. I'm delighted to be here. I want to thank Sandra and the Lear Center for inviting me. This is a really important gig for me. I get to do this sort of thing. I'm a neuroscientist, pocket protector, neuroscientist by training. You know, they don't let me carry that around anymore. The staff say, don't do that. And Sandra told me my picture was going to be up there. This is my glamour shot when I became the deputy director 6 years ago. Yeah, stress. Number one reason for all kinds of things. And so I do this out of a commitment and a passion for this issue. Family history with addiction. And I wanted to start by telling you a story, because you're all storytellers. I'm a consumer of the stories you tell. I watch television a lot. We got a dog that liked to put on elastic waist pants to sit on the sofa with us and watch TV and movies. I mean, so this is you are my peeps. I really enjoy what you do, and I'm going to play a Sophia on you from the Golden Girls. Picture this: 1976. Newly minted bachelor degree biologist, psychologist, can't decide whether he wants to go to medical school or go into research. Did undergraduate research in diabetes research. Thought that was really very important and very interesting. Decides to go work in the Boston VA, Veterans Administration Hospital, to see if he wants to go to medical school. And if you like medicine in a VA hospital, remember, picture this, 1976, then medicine is your calling, because that was socialized medicine in 1976. And so that didn't quite work out the way I'd hoped. So I ended up going into a research career, but one of the things that I'll never forget, remember, year is 1976, and our treatment of cancer has changed dramatically over the years, but the laboratory I worked in was on a chronic wing of the hospital where patients had chronic diseases, and you would often see the veterans, old gentlemen, being wheeled to the radiation floor where they'd be getting their radiation, and back in those days they would draw with dye purple lines so that on individuals, on their bodies, on their faces, on their throats, so that you could identify what areas were being irradiated. And I'll never forget that sight of these men, these veterans who had served their country, and they were getting appropriate medical care. But I'll never forget the sight of more than one sitting in the cafeteria where they were allowed to smoking a cigarette through their trach tube. That's addiction. That's what we're talking about. Compulsive drug seeking and use in spite of the negative health and social consequences. You can't stop. That's addiction. And